My name is Sujatha Jesudasan, and I work with Generations Ahead, a social justice organization working to expand the public debate on genetic technologies to ensure that communities of color, women, people with disability, and LGBT communities are part of the national debate on what are appropriate uses of genetic technologies and ensuring that we all share in the benefits. There is a very strong temptation to think that differences in health disparities, the higher rates of breast cancer or higher rates of asthma, can be explained by genetic differences in race, and that is just not true. We know based on history that there has been long-standing attempts to create hierarchies of biological categories and genetic categories, and that certain either behaviors or attributes are then attached to these categories. This is very dangerous because then it will say that, for example, higher rates of breast cancer among African American women is not because of lack of access to health care or based on the environments that they live in, but is more based on the fact that supposedly African American women all share a particular set of genes, or that Latinos have higher rates of asthma not based on the toxic environments that they live in, but it's more based on their genes as Latinos. This could be very dangerous for communities of color, and it is just not scientifically true. A particular tool for ensuring racial equity is the use of race and equity impact assessments. In this conversation about race, genes, and healthcare reform, we should be sure that we're using these impact assessment tools to assess that communities of color both have access to these technologies and that they are not harmed in the ways that race and genetics are used together. So please be sure to sign on to the Compact for Racial Justice, read the essay on biotechnology, and in particular continue to advocate for the use of racial impact assessments in all of the policy work that we do.